Assalamu alaikum, my dear friends. Welcome to the pharmacology's lectures. By the name of Allah, the term pharmacology is derived from two words: pharmaco, which means medication, and logy, which means study or knowledge. The definition of pharmacology is the body of knowledge concerned with the action of chemicals on biologic systems. In other words, pharmacology is the study of medications or chemical compounds which interact with various living systems, from tiny molecules to cells to tissues or whole organisms, in order to produce a certain effect. Medication is a substance used to prevent, diagnose, and treat the disease. Medication and prevention, like vaccines, and medication and diagnosis, like barium sulfate, that is used as a contrast agent in imaging studies like X-rays or CT scans to diagnose conditions in the digestive tract, and medication and treatment like antibiotics for bacterial infections. The medication at least has three names: the chemical one, describing its chemical structures and use mostly in scientific studies, like N-acetyl P-aminophenol, a generic name which is usually a shortened version of the chemical name and is mostly used by health professionals, such as paracetamol or acetaminophen, and one more brand or trade names given by the pharmaceutical companies that make the medication, such as Panadol or Tylenol. Once a medication is administered, it starts interacting with the body. This interaction can be broken down into pharmacokinetics and pharmacodynamics. Pharmacokinetics refers to the movement and modification of the medication inside the body. In other words, it's what the body does to this medication. So, once the medication gets administered, it first has to be absorbed into the circulation, then distributed to various tissues throughout the body, metabolized or broken down, and finally eliminated or excreted in the urine or feces. You can remember this as ADME. ADME: absorption, distribution, metabolism, and excretion. Pharmacodynamics, on the other hand, refers to what the medication does to the body. So, once again, after the administration of a medication, it binds to receptors or specialized proteins located on the surface of or inside the cell. This gives rise to a signal cascade, which ultimately results in some change in the cell's function, like boosting the production of particular type of protein or slowing down DNA replication. An ideal medication would produce a single beneficial or therapeutic effect for a certain disease state. In reality, most medications produce several unwanted effects, called side effects, like nausea or fatigue.